Yeah.
You proceed your session now.
Yeah, Dr. Sweetie. Dr. Sweetie Thomas.
Yes, I'm there, ma'am.
Yes, ma'am. You can start your presentation.
Okay, ma'am. Can I share my slide?
Yeah, sure.
Okay, ma'am. Thank you. Is it visible?
Not yet.
Okay, ma'am.
Dr. Sweetie?
Yes, I am presenting, ma'am. Yes, please wait, ma'am.
Okay. Yeah, now your screen is visible.
Okay, ma'am. Thank you. Good evening, everyone. So myself, Dr. Sweetie Thomas. So I would like to present my topic titled Redefining Public Distribution System in the States of India, an Impact Assessment of National Food Security Act. This is with regard to the states of India. So the public distribution system, as we all know, it is the provision of essential commodities at such prices through control shops, ration shops, and PDS shop.
Your PPT is not yet visible, ma'am.
Okay, yes, I'll share it. Now is it visible? Is it visible now?
No, it's not yet.
Okay.
Still loading.
It is India's public distribution system. It has achieved its targets during the past 10 years. And National Food Security Act, it was enacted in 2013, and it was to ensure the provision of essential commodities to 75% of the urban population and 50% of the rural population, and it has covered a majority, 2/3 of the population of India. And National Food Security Act 2013 is revisiting the approach to food security by initiating progress in the backward states of the country. So going to the next slide. So is it visible?
Not yet visible, ma'am. Just stop sharing and then just try again, no?
Okay, ma'am. Okay.
Yeah, now it's fine. You can just put it in the slideshow mode.
Make it full
Slideshow.
screen.
Yeah.
Sweetie, make it full screen, please.
Yeah, please continue. Dr. Sweetie, I think you're on mute.
Okay. So can I continue, ma'am?
Yeah, please continue.
So the National Food Security Act is revisiting the approach to the food security by initiating progress in the backward states of the country. Yes. Moving on to the next slide. It is not. The review of literature shows studies of the Tarosi study by Tarosi in 2003 and studies the less subsidized price of rice in 1992. They all have done based on the difference in difference method. That's a method of impact assessment, united method for the impact of Security Act on the PDS in the states of India. Then based on the next study by Kochar, PDS price policy reform accompanied by effective stative measures has increased purchase and diversification of poor households. Rai Chakrabarti, Kishore and Roy, the study by them, 2016, shows that the change in consumption of large review of literature. The objectives of my study are to compare the PDS coverage. The second objective is to estimate the interstate differences in the impact of PDS policy changes on the purchase of PDS rice in the states which have completed the PDS reforms in India. The data sources and methodology used for the study are NSSO reports for 50th round in 1993, from 1993 to 94, on the titled household consumption expenditure, and the 61st round and 68th rounds of NSSO on the topic public distribution system and other sources of household consumption. The detailed methodology I have followed for my study shows that the difference in difference method, the impact of decline in the price of PDS rise to ₹3 or less in the two groups of states, that is treatment and non-treatment or control groups of states, using the difference in difference method between 2004-5 and 2011-12. So the states have chosen the treatment group of states as well as the control group of states. The treatment groups of states are Bihar, Chhattisgarh, Haryana, Karnataka, Madhya Pradesh, Maharashtra, Punjab, and Rajasthan. These states are the NSSO major states under the NSSO report. And in the states which have more than population more than 2 million, and also these groups are these treatment groups have implemented the National Food Security Act in prior to the before the control group of states. So during the initial phase itself, they have initiated a set of reforms based on the NFSA Act. That is the ICT tools they have used, SMS alerts, and the doorstep delivery of food grains. So all these reforms have been initiated during the first phase by the treatment group of states like Bihar, Chhattisgarh, Haryana, Karnataka, Madhya Pradesh, Maharashtra, Punjab, and Rajasthan. and the control group of states, they implemented, they are in the stage of implementation: Andhra Pradesh, Assam, Gujarat, Jharkhand, Kerala and Odisha. Kerala, Odisha, Tamil Nadu, Uttar Pradesh and West Bengal. Going to the next slide. The regression equation used for the difference in different methods shows that the regression equation is phi HST is equal to beta 0 plus beta 1 AHST plus beta 2 THST plus beta 3 AHST into THST plus XHST plus the error term. The YHST stands for outcome of households in states in a particular time period. Here, the outcome was taken as average quantity of PDS rice purchased in kg. Then AHST is equal to 1 if the increase in PDS purchase of rice in 2011 to 12. If there is increase, the HST is taken as 1, and HST is 0 if the increase in PDS purchase of rice is before 2011-12. If it is in 2011-12, HST is equal to 1, and if it is before 2011-12, HST is selected as 0. Then THST is equal to 1 if if the state is in treatment group, and THST is equal to 0 if the state is in control group of states. Then the interaction between two dummies, that is AHST into THST, that shows the beta 3 coefficient, that is the interaction coefficient. This gives the DID, difference in difference estimate, that shows the impact, how far the national food security has had an impact on the PDS of these states. Then XHST shows the controls, that is the land poses, social groups, and so on, the other factors, other variables influencing the variable YHST. So the major findings of the study shows first, it has been tested for parallel trends. The parallel trends shows that whenever there is an impact, there will be deviation from the parallel trends, and it moves. If there is no impact, then it will be both treatment and control group of states will follow a parallel trend. But we can see after 2004-5, there is a deviation in the treatment group of states that shows that there is an impact of the NFSA implemented on these states, because they have initiated the set of reforms at the initial stage. So the conditional DID impact, difference in difference impact with covariates, shows the dependent variable and DID impact and the treatment state, the quantity of PDS rice consumed with one control variable, that is the DID impact is 0.870, and quantity of PDS rice consumed with two control variables 1.150, and in the treatment state it is 0.631 and 0.522 in the case while taking two control variables. So the major inferences of the study are based on this: positive coefficients on the difference in difference dummy and treatment dummy in table above. There is a positive coefficient. So it shows that a targeted public distribution system that was implemented in 1997, distinguishing between BPL and APL categories, worked better in the treatment stage during 2004-5 and 2011-12. After treatment dummy is negative due to the fact that there is some of the control group of states like Andhra Pradesh, Karnataka, Kerala, and Tamil Nadu, where the average quantity of PDS rice did not increase in 2011-12. In treatment states, there was a notable increase in the average quantity of PDS rice in 2011-12. Similar to this, a study by Kishore and Chakrabarti in 2015, the interaction term labeled the DID impact is statistically insignificant while estimating the DID impact. The policy implications from the study are, the study shows that states which have initiated the reforms have effectively improved their PDS, and the initiatives can be adopted and implemented by other states for the better functioning and delivery of public distribution system. The present study on the impact of PDS reforms finds evidence for an effective modification in the purchase of PDS rice as an impact of initiating the PDS reforms and taking the coverage of public distribution system, that is the coverage of households, coverage of PDS shows the coverage of population of PDS in India, that is measured by household size in the NSSO report, that increased in rural India from 24.4% in 2004-5 to 45.9% in 2011-12, and in the urban India it increased from 13.1% in 2004-5 to 23.3% in 2011-12. That was the first objective. And based on this, my study has shown that the National Food Security had a crucial impact on the states which has adopted the National Food Security Act and implemented it in an effective way. Thank you.
Yes, Dr. Sweetie Thomas.
Yes, ma'am.
So I have a question. So with
Yes, ma'am.
regard to your data, it is only up to the year 2012.
Yes. So the recent available NSSO report, it is available for consumption round. This last available one is 2011-12. So and after that, none of the NSSO on consumption expenditure is not yet out. So that is why the NSSO report 2011-12 was chosen, and that was the reason why I took this report. So that is based on secondary data. So the most available one is for the that is the 68th round.
Okay, one more thing. So according to you,
Yes,
what do you
ma'am.
think that what are the issues and challenges in PDS in India?
India, that is the excess diversion in public distribution system and also leakages, same, and there are also targeting errors. That is, some entitled beneficiaries, those who have the right to get PDS, they are deprived from that, and also there is the case of diversion. And also, in order to overcome these issues, cash transfer scheme has been initiated as a method, and also the case of Aadhaar linked biometric interface also, it is used for this purpose nowadays with a women head household. So these are the initiatives to overcome such issues also, and these are the main challenges, like diversion as well as the targeting errors.
Okay. Audience, do you have any questions? Okay, Dr. Sweetie, thank you.
Okay, thank you, ma'am.
Thank you. It's Dr. Vijay.
Yes, madam.
Yes, sir. You can start your presentation.
Yeah, thank you so much.
Dr. Sweetie, you can just close your presentation so that he can start it.
Okay, ma'am.
Yes, sir. You can share your screen.
Yeah, yeah. ma'am.
Yes, visible.
Yeah, I think I'm audible and my screen is also visible.
Yeah, you're audible, but your PPT is not yet open.
Like in my screen, it was there.
We can see your screen,
Yeah,
but PPT is not yet visible.
PPT is not visible.
Please click on the PPT, sir.
Yeah, clicked already. In my laptop, it was
But we can
open.
see only your desktop screen.
But I have opened the PPT.
Just close the PPT. Yeah, now it is visible, sir. Put it in slideshow
Visible now?
mode. Yeah, it's visible.
Yeah, now, madam.
Yeah, please continue.
Yeah, thank you so much. Yeah. At the very outset, I thank the organizer for giving me an opportunity to present my research article on public health, recent developments in technology. Myself, Dr. Vijay, assistant professor from S.A. Manu Law College, Gadag, and I'm going to present my research paper on public health, recent developments in technology. So as it was very much clear that the right to health is an essential component of human dignity, and it is in the responsibility of the government to ensure that this right is protected and promoted for all the individuals. The COVID-19 pandemic has grown rapidly, evolving new developments in digital healthcare, and governments around the world are experimenting with different ways of introducing technological tools in the management and delivery of health care services. The healthcare has changed dramatically due to the advancement in the technology, from anesthesia and antibiotics to MIR scanners and radiation therapy. And future technology advances will continue to transform the healthcare. And while technology, new drugs, new treatment, new devices, new media, then monitor healthcare, etc., will drive innovation, and the human factors will remain one of the biggest barriers to the innovation. Through use of innovative technology in healthcare, we hope to provide updated and holistic healthcare for the care seekers, and consequently increase their quality of life. This state-of-art center will serve prudent efforts to providing high quality and affordable healthcare for all the sections of the society. Equipped with the latest technologies and healthcare practices, it helps in providing the best diagnostics and the treatment at affordable prices. Technology drives healthcare more than any other forces, and will continue to change in the future. Uh, the healthcare technology refers to information technology tools or software designed to boost the hospital and administrative productivity and give the new insights into the medicines, treatment, or improve the overall quality of healthcare provided. The public health is primary goal, focuses on protecting and improving the health of the communities. Public health technologies helps reach these goals with greater efficiency. When applied to the public health stimulations, technology provides public health professionals with advanced tools to obtain accurate, detailed population data in real time. This data can help them build more effective actionable health strategies, covering a range of scenario, from individual care strategies to coordinating support system that can address widespread diseases outbreaks. Uh, Let me present the what are the benefits of this healthcare, and mainly there are two benefits of health technology. That first one is health tech improves the efficiency, and another one is health tech promotes the quality care. So let me deal with how the health technology improves efficiency, improves the efficiency. The way we purchase healthcare is becoming more accessible to wider group of the people through the insurance technology industry, sometimes called InsurTech. Then patient waiting times are declining, and hospitals are more efficiently staffed thanks to artificial intelligence and predictive analytics. Even surgical procedures and recovery times are being reduced thanks to the ultra price robots that assist in surgery and make some procedures less invasive. Then secondly, healthcare promotes the quality care and in expanding access to the healthcare and improving the hospital operations in fantastic. But how exactly we innovators accomplishing this feat? Healthcare technology companies have provided much needed jolt of efficiency by tailoring experiences to the individual. These companies realize there is no one size fits all approach to proper care. So customization is key. By personalizing everything from insurance payments to diets and sleep patterns, health technology companies are working to improve the human health and reduce much of the unnecessary strain on the industry. Some of the technologies which are used in the public health is, that is, one is geospatial technology, and this geospatial technology has range of healthcare functions, but perhaps one of its most interesting might be its ability to provide information that can help improve public health. Geotechnology collects information about the several factors, analyzes the data, and displays the result on multi-layered map. For example, that this technology can provide in-depth information on diseases within the specific region, health risks by age group, care delivery, logistic, and other social factors. And this technology functionally and purpose quickly rose the greater prominence during the COVID-19 pandemic. Then secondly, Twitter monitoring. This was also one of the technology which has been used in the public healthcare. The Twitter has much more to offer than and health care professionals are now using popular micro platform to monitor the spread of infection diseases, including the COVID-19, and predicts diseases activity. Then another one is wearable technology. Wearable fitness bands allow users to easily track their movements throughout the day, and this metrics such as total steps taken, heart rate, then run or ride pace, or the amount and quality of sleep each night help individual better to identify and track and achieve their own health and fitness goals. Then another one is 3D printing. This 3D printing technology enables the medical professionals to produce patient-specific models that exactly replicate the trouble spot inside the patient. The surgeons are then able to physically handle the models, examining them, and stimulating the variety of possible procedures to bring better informed solutions to the operating room. Other examples of 3D is to include functioning of artificial ear from scientists at Cornell University, blood vessels from researchers at the University, and skin cells, etc. These are these few of the examples, and 3D printing also become a vital asset in public health response to the COVID-19 pandemic. A host of 3D printing devices and tools have been created to make fight against the COVID-19. Then telehealth. This is also one of the another technology which we can use it, and even that telehealth can be used in the mobile and smartphones, cell phones, mobile devices, and PCs are helping connect the patient with their practitioners. People too ill to attend the clinic without adequate transportation or without spare time can video conference with the trained health practitioners through the apps such as Doctor on Demand and Now Clinic. Additionally, of the health insurance industry, major players offer some of the telehealth of their health coverage options. The rise of mobile health or mHealth has significant implications not only for the United States but also developing in the developing world. The data analyzed that most of the everyone now around the world is having the mobile, and the each of one is accessing public health and medicines use of different therapies, etc., from the mobile itself. Then the recent developments uh, that in public health and the roadmap ahead is that recently there have been significant developments in public health around the world, and these developments resulted in better health outcomes, reduced the mortality rate, and increased the life saving in all the ages. All the ages. One of the most important achievement in public health is the eradication of smallpox. The virus caused severe illness and caused the death of millions of the people worldwide. However, through the coordinated effort involving vaccination campaigns, surveillances, and containment efforts, smallpox was eradicated in 1979. Another significant achievement in public health is development of vaccines. Vaccines have played a crucial role in preventing and reducing the spread infection diseases. Vaccines campaigns have been instrumental in reducing the incidence of diseases such as malaria, polio, etc. Then even COVID-19 providing protection against these diseases and reducing their impact on individual and communities. Advancements in public health systems and infrastructures have also had played a significant impact on the public health. Improved healthcare systems, quality health services, including the preventive care, diagnosis, and treatment, has resulted in better health outcomes, increased life expectancy, and reduced the infant and material mortality at all the ages. Most importantly, various health financing initiatives taken by the different countries, the government funded health insurance schemes, government funded health insurance schemes, then free primary and preventive care, health vouchers, patient assistance program, etc., have instrumental in making the above mentioned healthcare services accessible and affordable for the class or the community at large. In addition, technology such as telemedicine and mobile health has made it easier for the people in remote and in remote places, so that through the mobiles, through the technological development, they can access very easily to the public health. In global health context, international cooperation and collaboration have been crucial in advancing the public health worldwide. Various international organizations have played a key role in coordinating efforts to combat diseases, against the diseases, and improve the healthcare system and address the global health issues. And the World Health is playing a very important role at the international level, which is one of the organ of United Nations organization. This cooperation has enabled the countries to share the information, resources, and expertises, and leading better health and to health across the world. Despite of significant advancement in public health, there are still many challenges that need to be addressed. In low-income countries, availability and access quality healthcare services still remains a challenge. In high-income countries, diseases such as obesity and some of the other diseases and mental health issues are becoming more prevalent. To address these challenges, there needs to be continued focus on improving the healthcare financing, healthcare system, promoting health lifestyles, and investing in research and development. In addition, international cooperation and collaboration must continue to be priority to address the global health issues such as pandemics and emerging diseases, etc. Etc. To conclude, innovation and development in public health have paid a significant impact on the lives of people across the world. The eradication of diseases, the development of vaccines, improvements in healthcare system, the introduction of healthcare financing instruments, then public health campaigns and international cooperation have all contributed to the better health outcomes, increased life expectancy, and reduced the death rates. Smart technologies in healthcare is changing the game in the more way than one, with more monitoring treatment options available to more people. Physicians can use the data and AI and other innovative new tools to make more proactive data-driven approaches to the healthcare. However, there is still much work is to be done to address the remaining challenges and to ensure that everyone has access to the quality healthcare services and opportunity to live a healthy life. And that can be done with the coordination and cooperation through the international sphere. So this is my presentation, and I'll end with my presentation.
Yes, Dr. Vijay, it was nice presentation.
Yeah,
Gave
thank
an
you.
overall view about the technology in healthcare.
Yes.
So one question. So what do you feel like, what are the challenges in rural India with regard to implementing this technology? Even though there are a lot of advancements, but
Yeah.
what are the challenges in rural India?
In
according to you?
in rural India, there is a no proper network, and even most of the peoples are poor, and due to the poverty, it is very difficult to take the facilities available in the healthcare because of lack of money. It is very difficult to the poor person to access to the new technologies. So that some schemes can be made by the government. So
Yeah.
government can come with some schemes, some policies, so that those technological development can be used by the rural people also. Because nowadays, for example, if there was a heart operation, that will take 5 to 10 lakh rupees, and now it is very difficult on the part of the rural people to spare that kind of money. And even liver transformation, heart transformation, these are the some issues which are require the financial help. So that can be done with the governmental help, and policies can be made, and the insurance schemes can be made by the government, so that rural people can also access to the technological development.
Yes, rightly said. So the role of government is very, very important in reaching all
And
these
even
technology and advancements in rural.
yeah. And it is the if you go to our Indian Constitution, we have the dietary principles of state policies, and in dietary principles of the state policies, it is the responsibility on the part of the government to make the policies, and the state has to strive for the health of the citizens of India, and for that some schemes can be made, and some policies can be framed, some laws can be framed so that the rural people and the needy people can take care of their health.
Yes. Thank you, Mr. Vijay. From the participant side, do you have any other questions to ask? Yes, sir. Thank you for your presentation.
Yeah, ma'am. Thank you.
Ms. Priya?
Ma'am.
Yeah, now you can present, ma'am.
Okay, ma'am.
You can take 10 minutes for your presentation and then we can
Okay.
discuss.
Ma'am, is my screen is visible?
Yeah, visible. Please continue.
Okay. Hello everyone. I am Priya, research scholar from Indira Gandhi University, Haryana, representing the research paper entitled as Driving Empowerment, a Holistic Insights into Women Entrepreneurship and Influencing Factors. Entrepreneurship serves as a cornerstone for the economic development of both developed as well as the developing nation, contributing as a backbone of the country's economy. It serves as a catalyst agent and plays a very vital role for the sustainable economic development.
You need not
and
read you need not read sentence by sentence. You can just give an overall view and then
Okay.
we can move on to the main thing.
Okay, ma'am. As we all know that women consist around half of the world population, and we can't imagine the growth and the development of the economy without acknowledging the important and significant role of the women in the society. So women entrepreneurs are the most important part of the economy and plays a very vital role in the growth and development of any nation. So it is one of the greater aspects that encompasses a wide range of the factors that influences the technology, finance, healthcare, and others. So women enterprises face some multiple challenges like they have a limited access to the resources and gender pay gap, gender differences, and other unpaid care responsibilities, etc. So addressing these challenges and barriers are very important. It is not just for fairness, but it is also very important to unleash the potential of women entrepreneurs. And this is a review of literature related to this field. And on the basis of literature review, these are basically my research objective. The first research objective is to assess the employment landscape of women in India. The second one is to assess the proportionate distribution of enterprises run and managed by women entrepreneurs within the context of Indian business landscape. And the third one is to highlight the factors that influence the women's entry into the entrepreneurship field. And on the basis of these research objectives, the research question are: what is the employment landscape of women in India? What is the proportionate distribution of enterprises that are run and managed by women entrepreneurs in India? And what are the multi-phase factors that influence the entry of women into the entrepreneurship? And in order to achieve the desired objective, we have employed the secondary data, and it has been collected from the various sources, including the MSME reports, PLFS reports, MOSP, and the various other research paper as well as reports. And the various tools and techniques like visual aids and other literature review technique, comprehensive literature review technique has been used to analyze the findings and the contribution of this study to enhance the depth of this research work. The first objective is the employment landscape of women in India. So the data is collected from the website of PLFS in MOSP. So it includes that only in India, only 32.8% women are currently in labor force, and the rest of 67.2% women are out of the labor force. So it represents a very challenging condition of India in terms of women participation in the economy. And if we want to grow up the economy, we can't ignore the important role of females in the economy, because females contribute around half of the global population. And among the females who are the part of labor force, only 19.7% women are self-employed, 5.3% are regular and salaried wage employed, 6.8% are casual labor, and 1.1% are the unemployed. So it represents a very challenging condition of India, and even we can't assume the growth of any nation without acknowledging the important role of women in the society and economy. And this landscape indicates that self-employed is 19.7% women are included in self-employed sector. Among the self-employed, the agriculture sector contributes 3.1%, secondary sector constitutes 2.6%, and service sector include 2%. So this is the self-employed contribution of women in India. And the second one is the percentage distribution of enterprise that are owned and managed by women in India. So it represents the three forms like micro, small, and medium enterprise. So the micro involved 79.56% having male and 20.44 is of female. 94.74 is of female. Males are in small category. 5.26 is of female. 97.33 in medium category and 2.67 is in female. So it represents a challenging condition of India as women own a very small portion of the enterprises in India and a very low portion of women are currently self-employed. So this is the graphical representation of women's and men's holding in MSMEs. And this is the percentage of rural and urban. This is the rural and urban wise classification of enterprise held by male and females. And this is the data that represent the contribution of percentage distribution in rural area that is owned by males and female, and the percentage distribution of enterprises in urban areas that are owned and managed by males and females. So in rural area, 77.76% are owned by male and 22.24 are only engaged by female. On the other hand, 81.58 by male in urban areas, beside only 18.42 by the females. The next objective is to identify the factors that influence the women entry into the entrepreneurship. So basically, on the basis of comprehensive literature review, I have explored the various factors that affects the women entry into the entrepreneurship. The first is the social culture factor that includes the social norm and cultural barriers that stops the women entry into the educational field and the entrepreneurship also. The second one is educational factor, the low level of education, low knowledge, low skills. So these factors stop women to enter into the entrepreneurship field, and the unpaid care work at home and the child care responsibility, family responsibility. These are the major another one factors. There are some institutional factors like legal framework and government policies. So these affect the entry of women into the entrepreneurship. Second, and next one is the technological factor that the women have the lack of knowledge about the technological advancement and lack of access to the digital platforms like UPI, PhonePe. These are the digital payment where the women have the lack of access, due to which they do not get entered into the entrepreneurship field. The next one is the economic factor, like the gender pay gap, that including the income disparity, limited access to financial products and services, and a limited economic opportunities. These are the another one factors. And last one is the psychological factor that includes the self-efficacy and the risk tolerance. Women have the less risk tolerance capacity, so that's why they do not move towards the self-employed category. So these are the basic factors that stops the women entry into the entrepreneurship. So empowering women is not only essential for their individual growth, but also required for the growth and development of entire nation at whole. And the current analysis show that women have a very little portion in the self-employed category. So government should take a variety of measures to enhance the engagement of women into the entrepreneurship field. So this is the basic findings of this study. The limitation of this study, as this data is completely based on just entry data. So the result of this study, accuracy of this study depends on the reliability of the data sources, and future research work within this area can be conducted to analyze the longitudinal study that provide a more dynamic understanding of the changes in trending pattern of ownership over a period of time and the intersectionality of gender with the other factors like age, education, and status that can provide a more pronounced understanding of ownership dynamics within the diversified demographic groups. Thank you so much.
Yes, Ms. Priya. It's a very nice topic with regard to women entrepreneurship in India. So can you just highlight few schemes that government has taken to improve this
Yes, ma'am.
women entrepreneurship?
Yes, ma'am. Yes, ma'am. Ma'am, one is the Mudra scheme that was taken by the government of India in order to enhance the women entrepreneurship in India. Under the Mudra scheme, the government provide a financial assistance to the women under the three category, that is include the Shishu category, Kishore category, and Tarun category. In Shishu, they provide a loan to the business that are emerging nowadays, means business that are newly business ventures up to 50,000 rupees. And then in the Kishore category, they provide a loan and financial assistance to those business who are in already existence and require further fund for the growth and expansion. And in the Tarun category, they provide a loan to those business who are very high profile and need more and more fund for their future expansions. So one is the scheme is Mudra scheme. Second one is Startup India scheme. Startup India scheme is taken by the government of India in order to enhance the role of women entrepreneurs in India. And third one is the Prime Minister Employment Generation Program. So these are the basically program that are taken by the government of India to enhance the role of women in entrepreneurship.
Yeah, one more thing. With regard to this self-help group, so
Yes, ma'am.
what is your idea how far it is successful in India?
Ma'am, up to some extent they are successful, but I think more recommendations should be made to enhance the role of self-help group. Like they have to provide the credit facility to women to start up their own business without any collateral security, because the basic problem is with the women that they do not have the asset to put that as a collateral. So they have to provide the loan and the funding facility without need of any collateral securities, and more training programs should be incorporated by them in order to develop the skills and knowledge among the women regarding the use of digital platform and digital technologies, etc.
Okay, Priya. Thank you. From the
Thank
audience
you.
side, do we have any other questions? Okay, thank you.
Thank you, ma'am.
Thank you. Mr. Bala,
Yes, ma'am.
yeah, you can share your screen and start the presentation. So,
Sure, ma'am. Can you please keep me as co-host, ma'am? I am unable to share the screen.
please try now, sir.
Sure. No, host disabled participant screen sharing. No, please keep me as co-host, ma'am. Otherwise, I already uploaded the PPT. If you have it, can you please show it, bring it up?
Please try now.
Sure. Yep. Are you able to see my screen?
Yeah, it's visible.
Okay, sure. So let me put it in presentation mode. So yeah, hello everyone. Good evening and Merry Christmas. My name is Bala Toleti, and I'm pursuing my doctoral program at the Indian Institute of Management, Shillong, India. Today, I take this opportunity to present my paper on organizations' readiness in protecting their workforce from the health challenges in the post-COVID era. So in this presentation, I would like to refer to the organizations related to the information technology and its subsidiaries. The reason for this choosing this IT industry is one of the reason is basically I belong to IT industry, and me and my staff extensively worked on coming out with some kind of workarounds during the COVID-19 pandemic period. And also, if you see with respect to India, the IT industry is growing year-on-year basis. So this is the reason why I have chosen this IT industry as my research topic. So in this presentation, briefly, I basically divided this entire presentation into 3 parts. One is before COVID-19 pandemic era, how was the situation? And during the COVID, okay, what are the actions that organizations had taken up, and what was the impact on the society, on the country, and of course on the individual level, and also what are the post-COVID challenges, and how organizations should be, keep their resources ready to address any kind of such issues. So to begin with, so I briefly discuss about the situation before COVID-19 pandemic. So before the pandemic, if we consider the individual employee aspect, like employees tended to go to the organizations and work in the stipulated hours, and after that they go back and enjoy their personal lives, and their spending on the hospital bills or health insurance is as per the requirements of the individuals. Okay, and in India, most of the IT firms expect their workforce to go to office and work from offices, and to grant any kind of work from home, to give any permission kind of like work from home to any individual, like as a medium management or senior management level, we need to get a lot of approvals and then provide that work from home permissions to that individual workforce. So in most of the IT firms in India operate in 24/7 mode, and India is to get revenues like around, if you consider 2019, 194 billion US dollars much of revenues that earned from the IT industries. There were some support staff to provide necessary support services such as housekeeping, transportation, or food catering employees. So both the direct employees like IT employees and indirect employees were getting benefited. So overall, country-wise, the things were normal till end of 2019. But all of a sudden, the things changed drastically in the month of March 2020 in India. Both state governments and central government monitored the COVID-19 situation and provided the updates to the people on daily basis. And at this point, majority of the IT companies, like especially in South India, like Hyderabad or Bangalore, Chennai, okay, so they prepared for the worst case scenario. So most of the organizations educated their workforce on the pandemic, and whoever is willing to go back to their work hometowns and work from from their home or remotely, they have provided all necessary equipment like laptop or some kind of connection related equipment, and they sent them. And most of the organizations had ordered laptops in bulk. And at the same time, the telecom companies had enhanced their internet broadband capabilities. So employees moved from cities to their hometowns, and the remote working facility was started, and they started operating remotely. And these steps were termed as COVID-19 pandemic preparation steps. And of course, there were some organizations, they were unfortunately not, especially not related to IT companies. They were unprepared to tackle the COVID-19, and they faced the consequences like, disruption of operations because of the lack of workforce, or faced challenges on the employee retention, because the employee retention was the challenge at that period of time, and unable to extend the medical support, or supply chain vulnerabilities, and lost their customer and stakeholder trust. So this is basically because the financial conditions, because to dynamically shift from one state to another state, there's some financial implications. So they were unable to bear that financial expenses, or maybe they were unable to predict the seriousness of the situation, or the negligence because of lack of awareness. So these were the three factors, like those companies were not prepared for the COVID-19 pandemic. So when the pandemic started attacking the India, so the whole country came to a standstill. We never encountered a lockdown kind of situation in India. So at that point of time, nobody knew that this impact, how long it is going to continue, and also the public movement is strictly restricted, and a lot of confusion and the fear of getting virus, and precautions, these were prevailing across the country. And in that, unfortunate thing is, due to the COVID-19 pandemic, most of us lost our beloved ones, friends, and family members. Most of the individuals were impacted by the COVID-19 virus and suffered health-wise as well as on the finance angle also. So at the societal level, there was a sudden drop on the employment of the supporting staff. All of a sudden, the supporting staff from the IT firms, they lost their jobs. But at the same time, the COVID-19 taught us lessons. Okay, first and foremost thing is, as I mentioned earlier, like most of our workers, like daily laborers or the street side vendors, they lost their livelihood due to the lockdown. So the governments had provided a free ration to all the unemployed to safeguard their basic needs. And most of the IT firms extended their CSR, corporate social responsibility activities. In cities, towns, and even in villages, people started helping each other and donating food, essential medicines, and clothes to the needy. So this COVID-19 had given an opportunity to the people to extend their helping hands and help others and share their sorrows. So at the same time, coming back to the IT side, okay, at the same time, the IT people, employees, they started working remotely, and there was no impact on the, or breach on the, the day-to-day activities. The business was going as usual. And since the lockdown and future is uncertain, so these people, they started spending their time in, maintaining the good health, like started doing yoga or exercises, those kind of things. And also they started learning the new things. Okay, this way, both the individual and the employee organizations are also benefited. And in fact, majority of the organizations, they encourage their workforce to, engage themselves, because all 24/7 they will be in their homes. Okay, restricted the movements, and also they encouraged such things. So during the COVID pandemic period, okay, the steps were taken by the IT companies are really, maybe appreciable, because IT organizations are getting their revenues because of the, workforce, and to ensure their employees' mental, health. The HR personnel conducted virtual team gatherings and also carried out certain recreation programs to engage and socialize their workforce. Some firms made it mandatory for their employees to do certain physical activities like yoga, meditation programs, and all. And in case of any medical and medical need, or supply of any necessary medicines or doctor consultations, the organizations have tied up with the local hospitals and insurance firms and the local pharmacies. This way, the IT firms, the HR people, or call it as, the HR personnel, they help with these IT people, individual families, and ensure that they are hale and healthy. So some IT companies, they have extended their support to provide infrastructure assistance as well. And IT firms have given their employees an opportunity to learn new technologies. And also, if suppose in the unfortunate incident, like if the people are impacted by the COVID-19 virus, okay, they have provided some medical assistance, and also they helped in providing the necessary medical consultation as well. And when the COVID vaccines were available, okay, most of the IT organizations, they encouraged their employees and their family members to get them vaccinated. In fact, most of the firms, either they had tied up with the local hospitals or conducted a special vaccination drives at their premises. This way, the vaccines were administered without any chaos, and also the details were updated in the government website portal. So these steps were taken up by the government, local government and local community, and also the organizations on the need. Okay, so there was basically here what I'm highlighting is, this is the COVID-19 pandemic was a shift move, okay, from one state to another. Okay, so there were no certain standard guidelines were in place in the initial days. So everything is, whatever is required to safeguard the workforce, the organizations, they strived for, and now finally they achieved that. So this planning, execution, and monitoring activities are done dynamically by the IT firms. So, and in the next, like to address, like in the future, like post pandemic impact or anything, so mainly we can focus as a senior manager in the IT firm, I can foresee in these angles, like employee health related, or employee family health related, or employee finance related, and career related. These are the 4 aspects the IT firms should focus on and should address in case of any challenges. So first, let us consider the employee health related. So for this, the organizations may have to enhance their employees' existing medical insurance policies. Suppose employee or their immediate family members are suffering from the long term, we call it as long-term COVID-19 or post-COVID side effects or chronic diseases due to COVID-19. So in that case, the enhanced medical insurance can cover their medical or hospital costs. So that will, save their personal, expenditure. So, and also with the post-pandemic period, majority of the IT firms are asking their employees to return to the offices and work. So at this time, the organization should focus on training the workforce on the basic first aid and train them to handle some kind of medical emergencies. That is one of the important things that is required at this point of time. And organizations may recommend that their employees can undergo periodic precautionary medical tests like master health checkup or something like that. And prevention, as we know, it is always better than cure. So detecting any diseases would be earlier would be better. And organizations can provide gym and conduct some kind of wellness programs to their employees, encourage them to do regular exercises and play some kind of sports. This way, the employees can be physically fit, and also they can develop certain some amount of immune system in their bodies. And in the recent past, most doctors especially in India, it is happening. Okay, so they identified that there is a deficiency of vitamin D among the IT employees. This vitamin D is obtained directly from sunrays, but they can alternatively we can get it through tablets or injections. So organizations can ensure that their workforce they should not fall under the vitamin E deficiency kind of thing. And organizations can keep few medical response kits available at the workplace, so that in case of any emergency, there will not be any rush to the nearby medical center or any pharmacy, and later on they suffer from the shortages of supplies and all. And provided good workplace hygiene is always required, and encourage employees to maintain personal hygiene. And also organizations can inform about the hygiene practices among the employee families as well. So, and another one is if the employee is sick, okay, maybe due to some seasonal disease or in case of any kind of virus, okay, we may never know, right? So organization should encourage such employees to stay back at home. But of course, this statement would be a little bit harsh, but this way the organizations can help the society by preventing and the spreading of the virus or infection to others. And also the other point, organizations can provide necessary assistance to the employees working remotely, because even though the organizations are asking the employees to come to office and work, only around 60% of the offices are operating in such manner, and the remaining 40, either the employees are working remotely from home, or maybe they are working in the hybrid mode. Okay, that means three days in a week they are going to office, and 2 days they are working from home, like that. And if we come to the financial aspect, so organizations should ensure that work-life balance of their employees. And with this, the employees' mental health will be improved significantly, and this would increase the positive impact on the workplace. And from the employee standpoint, this helps in the lower medical expenditure, because mental peace means, yeah, it's like, yeah, it will give better immune system. So, and also providing work from home option or work in a hybrid mode. So this way, they can the employees can cut the travel costs, okay, while commuting from home to office and back. And organizations may have to provide proper infrastructure, and organizations can encourage and support their employees to stay closer to the workplace. That is one most important thing. Okay, because if suppose another pandemic or another outbreak is there, and if the people are traveling using the public transport or anything, then they can easily they will become like a carriers of that infection or something like that. So if they live closer to the workplace, then their commuting time would be lesser, and in the worst case scenario, they can reach the office by walk, or maybe they can stay back and work. So this way they will not get exposed to the public or other infections. And also it can help in the traffic congestion, reducing the traffic congestion, and also the carbon emissions as well.
Yes,
And
Mr. Bala, you can go to the conclusion, please.
oh, okay, sure. So the conclusion is, right now in 2020, okay, the organizations and the governments have taken the dynamic steps to tackle this kind of situation. But in future, in case of any such thing happens, or maybe post-COVID issues, then they can have a systematic plan, and they know that the work from home or remote working is working effectively in India. They can enhance that particular aspect, and also they can protect the employees by providing proper medical insurance and medical assistance. So these are the major points that any organization should keep up, and including their policies, business policies, and help their workforce. This is what my conclusion is, madam. And thank you. Any questions?
Yes, it was very well presented, and it's need of the hour also. So, with
Yes, ma'am.
regard to the IT people, the mental health and physical health both are very critical, and
Right.
still a lot of people are still in work from home,
Yes.
and a lot of things are there. So, it
Yeah.
is very critical. So, is there any particular reason why you have chosen this IT people?
Yeah. Because I'm into IT, ma'am. Okay, I have 27 years of experience in IT, and working in Hyderabad, and I have seen. Okay, and I personally, provided the laptops, everything, and in a swift manner, we changed it over the night. We changed our policies, and we granted all the necessary, instructions to the workforce, and we enabled the work from home during the COVID-19 time frame. Okay, so that is one major reason, ma'am. And IT is the one wherein the people can work from anywhere. Okay, so if you take, for example, banking or any other department, they need to face the customer, so they have to be physically present in a bank or hospital or wherever. If you take any other profession, but whereas IT has some exception, ma'am. So that is why I have taken. And also, whatever steps I mentioned here, we followed. And also, being a senior member in my organization, I involved in the HR and finance, and devised some kind of business strategy policies during the COVID time frame, ma'am.
Yes, sir. Thank you. So, any
Thank
other questions from the participants?
Yeah, I have one question, sir.
Yes, sir.
Yeah, it was a very nice presentation. Really, I'm thankful to you, sir. So, as you are presenting that COVID-19 and work from home,
Yeah.
and at the time of COVID-19, that helped more. That
Yes,
is
sir.
work from home. So now
Yes,
my
sir.
question is that. So how far after the everything is now placed,
Mhm.
and how far work from home is feasible?
Yes, sir. Work
Yeah,
from home.
after the post-COVID, now everything is placed at the same place. Now
Yes.
there is no any danger to the life and risk to the human being. After this, how far work from home is feasible, and we can continue with that work from home, and how it is it efficient?
Yes, sir. It's a good question. And also, it's like I can treat this one
Yeah.
work from home option as a win-win scenario, sir. Okay, take for example, in my company, sir. Suppose take for example, women employees. Okay, if the woman is a lady employee is married and having infant kids, okay, they either suppose if we don't provide the work from home option, there is no other option for that lady employee except to resign the job and take some kind of sabbatical. So if we provide work from home option to such employees, lady employees, then women empowerment we can enhance. And the second thing, sir, if we provide work from home or maybe hybrid model, okay, 3 days to office and 2 days can work from home. Okay, that is especially helpful to reduce the traffic, sir, especially in Hyderabad and Bangalore. If you see a lot of traffic jams and all are happening. And third thing, if the work from home initially we were under the impression that people may not work, but the employees, individual employees, they work more than 8 hours, sir, because on an average, if you take consider the travel time to home to office and back, it is taking on an average 1.5 hour to 2.5 hours. So that is saved, sir. So these things are considered, and people they extended their working hours, and also the kind of flexibility we have provided. So and one more thing is that if we provide work from home, there is a good chance that the attrition rate also will reduce, sir. So these are the benefits.
Yeah, sure, sir, sure. And another thing that you have said, that is based on the 60-40 percentage.
Yeah.
That was also very good. That 60% workers can work from in the office, and 40
Yes,
can
sir.
take the leave. On that basis, also that was one of the good idea that
Yes,
you brought at this platform. Thank you so much, sir. Thank you so much.
Thank you, sir. Any other questions?
Yes, sir. Thank you.
Thank you, ma'am. Thank you.
Thank you. I think 2 more participants are yet to join. Dr. Shobana is yet to present. And Babita is yet to present. They have not joined. So can we wait, ma'am?
I think Madam is not there.
Yeah. So thank you, participants, for joining.
Yeah.
Yeah. We'll wait for 5 more minutes and then close, sir.
Sure, ma'am.
Okay, okay.
Okay, sir. Thank you. I think we can close for the session. Thank you,
Okay,
sir.
madam.
Thank you
Thank
for
you.
joining.
Thank you so much.
Yes, sir. Thank you.
Okay,
Thank you,
Thank you.
ma'am.
Sir. Thank
Good
you.
night. Thank you. Bye.